Okay, welcome to this episode of the Two Druggists podcasts. I'm Dr. Matt, and today we're going to be talking about the top 10 errors related to COVID vaccinations. And I think this is a timely subject because, flu season started and the FDA just authorized boosters. So it's going to be busy, and as pharmacists and other people listening, we need to be cognizant of these errors. So today I'm going to go over the top 10 errors for vaccine-related errors with COVID-19 vaccines. These data is from the Institute of Safe Medical Practice, and I'm picking this out of Pharmacy Practice News because they did a great job summarizing it, and we're going to run through it. So immunizations are one of the greatest public health assets we've achieved as humans. It's right after clean water and septic systems, and how we administer and store and use vaccines can affect their efficacy. So we're going to look at some underlying causes of vaccine-related errors. This is an ongoing issue every year. There are vaccine-related errors at particularly administration, underdose, overdose, wrong vaccine, things like that. And right now we're going to focus on COVID-19. And I do have some notes down in front of me. Oh, I don't want the ad. That's okay. And I'm doing a screen share, so you'll see this. So the first thing we need to look at is this is a recent analysis of more than 160 COVID vaccination errors or adverse events. And this was recorded by ISMP, Institute of Safe Medical Practice, and the vaccine error reporting system between December of 2020 and April of 2021. Vaccine errors, because they can lead to inadequate immunity, increased cost, and reduced confidence in the healthcare system. And as we know, the battle of fake information related to vaccines, we can't make errors, folks. We really can't. So the first one, and I've experienced this in my practice with a couple of different vaccines. This is shoulder injury related to vaccine administration. I personally had to deal with a patient that had a shoulder injury, SIRVA, shoulder injury related to vaccine administration. In this case, a pharmacy intern who was still in school. Obviously, they were a third-year student, inadvertently injected a patient with Zostavax into the shoulder joint. It was bad. The patient had bursitis, frozen shoulder syndrome. It was not very good. So shoulder injuries occur and are related to vaccine administration. And that's when you have a direct injection into the shoulder joint. The healthcare provider doesn't adequately identify the margins and the triangular area for the deltoid muscle injection. So this injury is related to inflammation from the shoulder joint. And it's an injury to the shoulder tendons, ligaments, and the bursa. And this is, again, an incorrect injection into the shoulder joint instead of the deltoid muscle. So we've had reports of this during the COVID-19 injection campaigns. Some healthcare professionals or volunteers with expanded scope of practice have incorrectly injected patients in the shoulder joint. And again, these things persist hours to days after a vaccination. And this is acute pain, shoulder weakness, and the inability to move the arm through the range of motion without pain. This is different from, oh, my arm just hurts from I got my flu shot. This is pretty extreme pain that is not managed with over-the-counter NSAIDs. It can also be described as incorrectly a bursitis, a rotator cuff tear, frozen shoulder syndrome or adhesive capsulitis. So they got to rule those out. So the key to avoiding this injury is making sure the healthcare worker correctly identifies the muscle and the proper technique to give an IM injection, 90 degrees straight in. Making sure you use that 2-finger rule from the shoulder joint to make sure you're hitting the deltoid muscle. It's also good to make sure that your patient rolls up their sleeve and exposes the complete shoulder. Therefore, it removes any misidentifying of landmarks. And of course, I tell my students, if you're not sure, double check before you inject. So that's shoulder injury related to vaccine administration. Okay, that's number one. It's your most common error. Number two, not checking documentation in the immunizing information system. So there are reports where people have gone for a COVID shot, claimed it was their first when they had actually already received a immunization. So you need to be checking your documentation carefully. This also goes back to the screening checklist, making sure the patient's there for the proper immunization before you give it. So, if somebody's there for a shingles shot, you make sure you verbally assess the patient's name, check their questionnaire, make sure they've signed it for consent, make sure there are no disqualifying questions, and ask them what vaccine are they there for, and make sure that that's the correct vaccine they're getting. So for not checking the documentation, again, you can end up with wrong vaccine, wrong dose, too many doses. So you really need to check your paperwork and make sure you're giving the correct vaccine. In Maryland, we have the CRISP system. We also have Immunet. So our statewide immunization database is what we reconcile before an immunization. But it goes back to diligence of detail and making sure you're giving the right vaccine, not just assuming and sticking. So, and this is particularly tricky because you have to make sure, Pfizer is 21 days, Moderna is 28 days, Janssen vaccine is a one and done. So nobody comes back for a Janssen shot as of yet. And then you throw in the booster inoculations. You really need to make sure your paperwork is in order and you're giving the person the correct dose at the correct interval with the correct vaccine. Number three, wrong diluent. This one can be a big problem, and there are numerous reports of this. Janssen vaccine is not diluted. It is ready to go, 0.5 ml, multi-dose vial. Moderna is not diluted. It's a ready-to-go multi-dose vial, okay, 0.5 mLs IM. Pfizer-BioNTech COVID vaccine must be diluted. You have to add 1.8 milliliters of sodium chloride for injection. Do not use bacteriostatic sodium chloride. That is not appropriate. Nor would you rehydrate this vaccine with water for injection. If you rehydrate it with water for injection, you may actually damage the vaccine. Also, errors in wrong diluent have included wrong diluent volume. So, for example, not putting in enough diluent for the Pfizer shot, putting in 1 ml instead of 1.8, not putting in any diluent and withdrawing the vaccine content and giving it to someone. That's an overdose. That's going to lead to a robust, a very robust immune response and adverse reactions. So you're giving, if you don't add diluent, you're giving a concentrated dose, and you don't want to do that. So it's 1.8 milliliters of sodium chloride for injection into the thawed Pfizer vial. Okay, that's the only one that gets diluted. That is the only volume you're going to add. So there have also been reports that people have tried to put empty syringes of air into the vaccines without adding diluent. So again, you need to make sure your vaccine clinic, your pharmacy, your students are all aware of the proper procedure and have a double check. 2 people watching prevents errors. So you're going to, in large vaccination clinics, there's a higher risk of these errors happening. But as pharmacists, we want to do our best to prevent errors and maintain the trust in the health system. There's been at least one report where a nurse accidentally added 3 mLs to a Pfizer vial, and that would totally dilute the vaccine. Hopefully that vaccine wasn't used, but if it was given, you would lead to a under response, and that could cause breakthrough infections. Number 5, errors related to vaccine storage. So vaccine storage is tricky. Most vaccines that you're going to give in a pharmacy setting or a doctor's office or a hospital, 99% of them are stored at refrigerator temperatures. The COVID vaccines are a little trickier because each one has storage requirements: frozen, they can be in the refrigerator for a certain period of time, then out of the refrigerator, most of them are good for 6 hours. So you have to be careful about your thawing parameters. You don't want to store these vaccines on the same shelf. You want to separate them. In an ideal world, you would put them in 2 separate refrigerators, but that's way, way ideal. In most cases, you're going to want to separate them by shelves. So subsequent mix-ups, if you store Pfizer and Moderna together, people have grabbed wrong vials, added diluent, so on and so forth. So be careful about storing your vaccine. No serious fatal event has been reported due to COVID vaccine storage errors, but that's to be seen. Also, we need to store these we need to store these vaccines away from other drugs. There have been at least 2 case reports of people pulling insulin instead of a vaccine and administering insulin to people. It happened to 50 children at a flu clinic in Brazil. The reference is at the end of this article. It's also happened to nursing home patients, and I believe 1 person died. So there's also been at least 1 case of a neuromuscular blocker being administered instead of a vaccine. So vaccines really need to be segregated away from other drugs to prevent someone in a hurry, not paying attention, distracted, from grabbing the wrong vial and administering it as a vaccine. So that's really important. Insulin, neuromuscular blockers, vaccines need to be on a separate shelf away from all other drugs. So number 6, mix up with other medications. We just went over that. But there's another case report where at a COVID vaccine clinic, a nurse incorrectly grabbed a bag of epinephrine syringes that were pre-drawn and utilized those as vaccine. In that case, the patients were tachycardic, but no long-term effects were felt. But this is a great example of making sure your vaccines are labeled, your emergency supplies are segregated and easily accessible. Again, we don't want to have these errors. So again, keep your epinephrine labeled and away from your vaccines. In an ideal world, I would suggest carrying EpiPens instead of pre-drawn syringes. That way you can't mix those up, okay? Administration of an empty vaccine syringe. This is number 7. There have been multiple reports of empty syringes used for the Pfizer-BioNTech vaccine. It's most often seen at mass vaccination programs, often during preparation of large number of syringes and injections. So for these doses of vaccines, what you'll have happen is people will open these syringes and line them up on the table and pull them back to the prescribed dose so that the person drawing the vaccines can just inject the air, pull up the vial or the dose, and move along. Well, in some cases, people have mistakenly grabbed empty syringes thinking they were full of vaccine dose and injected patients with nothing. So this isn't good because we now have people getting immunized with air, and that can cause big problems because you're not going to be immune. So make sure you have two people, have a good workflow, as something as simple as empty syringes on one side, pre-filled syringes in a bin on the other, labeled. Also, labeling your syringes is very important. Don't assume because it's a drawn up dose that you know what it is. Make sure it has a label. So that leads us to number 8, wrong doses. Some individuals have received lower or higher doses than authorized. This is caused either by, one, not diluting the vaccine as appropriate, so you're giving them a concentrated dose. Also, if incorrect diluent is added to Pfizer, you're going to get a more dilute product. In other cases, it's a physical issue where the syringe is not affixed to the barrel, the needle is not affixed to the barrel of the syringe tight enough. And when you push the vaccine in, you get leakage around the needle head. Also, people pulling away or not going in far enough, you have vaccine leaking out of the skin. Also, the vanishing point syringes, if you push the vaccine in and then activate the plunger too quickly, you may actually retract that needle with vaccine still in it. So you want to make sure that you're doing things appropriately, giving yourself an extra second to let the vaccine get in before you actuate that vanishing point syringe. Also, make sure you've got an inch needle on there. Make sure you get in so that if the person does pull away, the vaccine the needle is still in the arm. Age-related events. So one of the other most reported common vaccine errors with COVID-19 administrations is patients younger than the minimum age on the EUA fact sheet. So, for example, someone younger than 18 getting a Moderna or a Janssen vaccine, or someone younger than 12 years of age getting the Pfizer-BioNTech vaccine. There have also been reports of adolescents 12, 14, 15 getting Moderna. There's at least one example here in the article where a 17-year-old at a clinic received Moderna instead of Pfizer. And then there's another example where a 15-year-old inappropriately received Moderna instead of Pfizer. So you have to you have to verify, these clinics are busy, but you have to take that second to identify age, vaccine, before you stick people. Number 10, vaccine competency. Many errors, such as drawing up the correct vaccine volume, shoulder injury related to vaccine administration, is often due to competency issues. So competency issues could mean your interns, your students, make sure they're trained appropriately with screening patients, drawing up doses, administering doses. It's never bad to, if you have new students coming in, make them inject you with saline. I've done that with several pharmacy students that I needed to assess their technique. Wasn't pleasant, but I could see what they were doing. One of the other things I do is each year, if I have a pharmacy student, I make them give me my flu shot, again, to assess technique. So correct dosage, right patient, right dose, right timing. You got to look at these when you're trying to avoid vaccine administration errors. So that concludes our list from Pharmacy Practice News. And so again, just because these are COVID-related errors, these apply to all vaccines. When we have pharmacy students, I pound into mine before you talk to the patient, you have to confirm name, date of birth, what vaccination are they getting, what arm do they want it in. Answer any questions before you administer. That is the fastest way to prevent vaccine administration errors. I've heard of cases where pharmacy students or interns have inadvertently given someone a pneumonia shot instead of a flu shot because there was a miscommunication. I've seen where somebody got a shingles shot instead of a flu shot because there was a miscommunication. And these sort of things give people pause about getting vaccinations. Errors don't help the PR. One really egregious error I had to document at work, not my current work, a previous work. Pharmacy student inadvertently immunized someone with a shingles vaccine in the bicep subcutaneously. Patient had a welt the size of a softball. It was terrible. I still have a picture of it. If I can find it, I'll insert it when I edit this. So don't just think about COVID vaccine errors. Think about preventing all vaccine-associated errors, because the more people we can get immunized correctly, the better off the country is going to be. I believe immunizations are one of the biggest public health assets since running water, clean running water, and sewer systems. So I think that's going to wrap it up. And I appreciate you listening, and we'll catch you in the next episode. I think next episode, we're going to review booster shots. So thanks for tuning in. Take care.